Hi everyone, I'm Huyen here. So I'm going to take you through chapter 3 and chapter 6. Chapter 3 is basically about accepting the ADHD brain that our child have, or maybe you have. And chapter 6 is walking through the school in their shoes. Okay, next. So on chapter 3, next slide please. Yeah. Chapter 3, it was saying that it started with this Maya, age 13. Actually a story. He said that this quote by her, having ADHD is like a thorn in my butt, but I laugh anyway. So he mentioned that what helped him accept the bullet brain is because of his math, his therapy, the parents. And they're so good at reminding me, and maths helped me focusing. So the therapist will help him understood, accept it. So he have it, he makes one mistake. When he make mistake, he just laugh over it. So this chapter will focus on what you can do to help your child along this rocky road to that destination that they like to go. So I like this quote, I am what I am, and that's okay. That's how the child feels himself. So there's actually basically 3 phases of acceptance. Phase 1, self-control. It's actually one of the 5 C's that the author have advocated throughout the whole book. So the first thing is self-control. So basically, there are 3 types of parental response to ADHD diagnosis. What are yours? Or is your child diagnosed? First type of parent, relief, well said. Second type of parents, distress. The third type of parent, which I am, in between 1 and 2. When my child got diagnosed, I'm relieved, but sad. But I'm not because I'm comfort, but then I remain skeptical because I'm not so sure are all the intervention useful. That's why when I joined Sparks, I got all the information. So like what they mentioned, that 3 parents tend to benefit from information about ADHD. Reading. They feel assured that ADHD is very common and manageable. So it's nothing to be distressed. The main thing is just reach out. So what are the kids' response? That is a parent response, right? 1, 2, or 3. What are the kids' response? They survive by creating names for themselves because they feel it fit their experience and feel better for them to use. Some of them name themselves as fast brain, bully brain, this minute only brain, ideal brain, or hyper brain. So this is how they label themselves to make it manageable as well. Next. So for phase 1, we need acceptance. Okay, so phase 1 of the acceptance process relies on compassion, which is another C. So remember, self-control, compassion is the second C. So how do we as parents be compassionate? Okay, so first thing, we listen to their words, what the child says. We reflect on their strength. Just now during the breakout, during the, what is it called, the team, what is it called? Icebreaker, yes. You all were talking about the strength of the child, what you really like. Some of you said they are thinker, they are creative, they are mechanic, they're super creative, they love gardening. So you are reflecting on their strength. But then we need to identify their challenges. So in this book, the author did mention there's one exercise tool. Ask all of us to reflect on all these questions. What do you like about your child? What do they do well? Which was just now the question we asked you. Include their special talent, interests, and hobbies. I think many of you know what the special talent your child has. That is very good. And what do you do fun together? Some of you mentioned cooking. Then you ask, what challenges or limitation does your child face? You can observe. If they're old enough, you can ask them. And what do they do when frustrated? What are their mechanisms of coping? How do you show them that you're upset but you still love them? There's something to do with consistency. And how do you give them feedback? So this 1, 2, 3, 4, 5, 6, 7. These 7 questions are very important. I suggest you just do a short exercise. I did write down all the things when I talked to my daughter. So interestingly, you can see that these are this is it's like a reflection of what you do to them and what they do to you. And there's no right or wrong, but I think we just based on compassion. Yeah, just compassion. Next slide, please. Okay, phase 2 of acceptance is collaboration. So you already compassion, you already listen to your child. So the next stage is on your partnership with them in identifying what goes well and what need improvement. That's where you collaborate with your child. So in conversation about all aspects of their life, the home, the school, sports, activities, if they're working, their jobs, their friends, encourage them to brainstorm with you what they would like to be different and why. They want to be different and they are different. Assist them in reframing their failures. So sometimes my daughter come to me, he got something, just listen with compassion, then see whether you can re-paraphrase their failures and point out the challenges. If you really cannot help, point out the support group. In the secondary school, they have the LBS. If you go to the poly, they have the counselor. If you need support in tuition, get the tutors. So get all these, reach out for all these support group. Like for us parents, we need support group, we go to Sparks. Okay? So the main thing is that we point out to them their support group in their lives who are available to help them and who wants to see them succeed. Very important, huh? Adults that wants to see them succeed. Okay, I think sometimes we will encounter tutors that doesn't want to see them succeed. Say, yeah, it's like that, it's like that, it's like that. So normally I will pull her out from that class and change the new tutor. So I think we all have to be very sensitive. Then you collaborate and co-create plans, then foster any desired changes. Show them that you're on their side. Okay, you have to be on your child's side for the long haul. Next. So some of you say, quite difficult. What could go wrong? You know, if I want to talk like my child, then sometimes they will say, infant, no, stop talking to me. I don't want you to talk to me. And sometimes they say they do not want extra help. But what could go wrong in this conversation? It's okay. If this conversation go wrong, if you continue to collaborate with them and find a win-win situation. The main thing is that you must open up with a listening ears. So click. The collaboration phase work best when people and parents are just focused on, remember the thing, information are overload, just focus on one thing that goes well, the strength. Then simultaneously focus on another thing, one thing only, that needs improvement. Just two things, don't overlap. You cannot do this, you need to pack out your room, then come, the toilet is still not clean. You don't overload them. Okay, just tell, oh, you have been doing well. You have put up the hanger. You have put up the clothes. Well done. You have load the laundry. Well done. But then your room still need a little bit of cleaning up, right? Something like that. Just make sure there's only two things. Don't complicate and don't overload them. Because sometimes we come back, wow, we come out how the whole house is a mess. Why this not? You start being like a crazy woman. But then tell yourself, self-control, compassion, collaborate a bit, talk about it. One thing that did well, and then another thing that need improvement. Enough. That's it. Thank you. Let's phase 3. So just now phase 1, phase 2, phase 3. So there's the last 2C. Consistency and celebration. Take your collaboration plan, put it to action, and make it stick. That is meant by consistency. So if it doesn't work, you can implement alternate approach to the old problem. So this one requires consistency and celebration, which in turn depend on efforting. What is efforting? Okay, we do not praise the child for, we all heard of this thing called practice make perfect. But for our child, practice make progress. Okay, progress. Don't seek perfection. Progress. We praise their effort, the efforting. Like Nathan, the David's father, sometimes said, I can't do this anymore. I can't hold it in the face, repeated defeats. So if you cannot do it, what we can do is we plan again, collaborate again, find alternative again, reduce the overloading, and then repeat again. If we really cannot, ask for help. Ask for help. Okay. So next. So the phase 3, new solution to any kind of problem have to include celebration. What is a celebration? Is it treat them to McDonald's, treat them to Burger King, or treat them, buy blind box for them? No, not necessary. It's just words. Thanks for cooperating. Nice job hanging out the tower. When you notice their efforting, they strive. You are their ally and their witness. I think in schools, they may not have nice words being taught to them, but at home, just take note of this small little thing and celebrate. Like just now I mentioned, practice make progress. That's what written by Sammy, one of the 8-year-old girl in the book. And Taylor, age 17. I'm sure my mom is the reason why I'm still in school, because she noticed my ADHD first. She would dot, 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 dot. I'm sure my parents are mad at me a lot for doing things I don't mean to do. But they are super patient. It is always, okay, here's what you did, let's improve it. Simple. Here's what you did, let's improve it. So, yeah, next please. So that's all for chapter 3, 3 phases, using the 5 C's. Okay, chapter 6, walking through schools in their shoes. Also 3 steps. Step 1, listen to the voices about school, the good, the bad, and the indifferent. So this is also one exercise that's in the book, school reflection. What are your child academic likes and dislikes? Any subject that he likes, any subject that he dislikes? What are your child non-academic interests and capabilities? Especially when you're in secondary school, the non-academic capability will play an important role, which is their CCA. So some of them, they mentioned in secondary school, CCA are their souls. They can be a dragon in the football court, in the football field. But when they come to a class, they are like I don't know what is that, a sleeping dragon. So we need to take note of their non-academic interest and capability, and what do they really like to do in school. In fact, they spend 8 hours in school, so we have to find out. And does any of this occur at school and translate into academic materials? Can any of these non-academic interests be translated into academic materials? If so, how? Example, if they like building things, can they collect and resell books in the classroom? So we do some translation, and maybe you can notice that he did certain things. You can suggest to the teachers, my child like to do this. Can you get him to be a leader or something like that? Find their talent and find their strength. Have you, a teacher or a child, noticed if they understand certain types of information differently? So this will lead to some learning disability. Are they fast with math concept but slow with math facts? Quick with puzzle but lagging with reading? So these are some a bit contradicting, but take note of some this type of information. I mean, take note of such because it's not disability, something that is a bit different. Yeah. So tips on having, okay, step 2. Honest conversation leads to change. Remember, the parents, they have to accept first. After that, you must have an honest conversation. So with who? With the child about school. So you just sit down, make a plan to sit down to talk about school at time or place that work for everybody. Don't do it maybe when they are having a meltdown. Yeah, some place, a favorite food, and talk to them and sit down about school. Share with your curiosity. And most important, share genuine interests, because they may be defiant. Repeat exactly what you hear from them, because they need to paraphrase. I heard you say, is that right? Then I think child will have their school, they have goals. What do you need goals? What are your goals for school? They should be specific. The child will say, I want to take art class. Like my daughter, she said that the art lesson was good. She said she wants to take art class. So I find my ex-colleague, which is an art teacher. So I bring her to that class and she go for art. I want to have enough grades so that I can play football. So these are very, very specific things you hear from them. And discuss with someone else who can assist them in making those goals a reality. Is it your colleague, like mine, again, my art friend colleague? Or is it a tutor? Or is it a counselor? Or even sometimes they may click with one of the caregiver, like the grandparents or the aunt. So, yeah. So see who can help, not grandparent, who can help him in achieving the goals. Maybe the instructor, maybe the coach. Sometimes they listen to the coach more than the teacher. So learn more from them. And then create action plan, which each person has a particular task to do. It's not that easy. Set a follow-up meeting for the following week. Okay. So of course, the last one, you must appreciate your child. Thank you for being honest and taking the journey with me. And you may also receive gratitude or may not, but they may not say thank you, but it doesn't mean that they don't feel it. It may be in other actions. Okay, step 2. Let's see what step 3. Okay, step 3. Step 3, this one is really neat. You really need the experts. So common academic challenge, reading. Audio, some of them may be audio learner, visual learner. They love friction versus non-friction book. So these are the academic challenge. Reading is a challenge. Mathematics is also a challenge. But one thing the book mentioned is you must approach mathematics. Remember, our children are very, very inquisitive. They ask why. You cannot say these are the formula, memorize it, and then you will score. They can't. They need to know the why. I think all childs are like that. So you approach with inquiry first. Then if we really cannot get help from school, from a tutor, or even a homework club, maybe another adult who are able to teach them better in the math, able to help them with their understanding of the math concepts. Writing, they did mention break writing assignment into small and achievable parts. Don't say write an essay 800 words, come back to see me later. So don't do that. Break it into small achievable parts. Make it fun. Encourage them to write from their own creativity. And do not proofread their grammar. Very important. Don't say, how come I got one mistake, how come the S not here, how come the comma not there? Let the teachers do it. They are the expert. We are not the expert. I remember my daughter, like one particular tutor, he said, I like the tutor so much. He just let me write anything I want. Not anyone. Give a specific title, like the most parent, the most inspiring parent, the most inspiring people you ever meet. So she will write non-stop. Yeah. Then he actually scored very high, and then the person actually is me, Then the tutor passed me the letter. This is what your child said about you. I mean, I don't really understand. I mean, I tend to proof it, but I don't proof it. I try to read and take out the intent. Yeah, but it's really quite touching. But the teacher gave him quite a high mark for the content. So what I'm saying is that even if you are teachers, don't proofread. Let someone else proofread. You will spoil the relationship. All the spelling mistake. I know I love to proofread, but don't. Okay? Yeah, even math also. Don't go and check through all the things. Equation correct, presentation correct. No. They will listen better from the expert. Okay? We are expert as a parent, not as a teacher. So kids with ADHD have knowledge and awareness on what they love. Don't say they don't know, they know. And what can do well and what is challenging about school. Their insights show that they know enough about themselves to join you in creative, effective, and lasting intervention. So that's all I have to share.